So, which brings me very nicely onto the next question, which is about the foods, because you mentioned that a few times. I mean, I think we generally have some ideas, we have given advice and guidance in terms of keeping blood glucose levels lower, what sort of foods. But in terms of oral health and diabetes, what sort of foods would you be recommending?
So, the thing that causes disease, especially dental decay, is really tied in with sucrose and kind of fermentable carbohydrates. So, a diet that's high in carbohydrates for generally the whole body is probably something that one should try and avoid or reduce. And so, if you have a high sugar diet or a high carbohydrate diet, a lot of this feeds into the bacteria in the mouth, and we've got more than 300 species of bacteria in the mouth. So if you're feeding these bacteria, they then, produce uh, uh, um, an acid. And so once the pH drops a certain level, it then destroys tooth mineral. So, these kind of things are things that should be taken into account. And so considered that, less carbohydrates important. Obviously, eating more fruits and vegetables, obviously, again, within reason, because if somebody has got diabetes, you may have to be careful with the kind of fruits that you eat. But in so doing, a lot of these fruits and vegetables and slightly harder foods as opposed to softer diet are actually better for you overall, better for your mouth as well as your body as well. So it's really looking at it in a level where it's avoiding processed foods, drinking more water, and some people maybe don't drink as much. And people who have diabetes, for instance, tend to have a drier mouth. So things like hydrating more, not eating in between meals, sort of the common things which are advised all the time, brushing after meals as well. That's quite important. Maybe using even a mouthwash is something that, is worthwhile trying to make sure that you keep your diet within the confines of a healthy diet, as well as, maintaining your oral health.
So you've said that the hard foods which require presumably more um, tooth action, if I can call it that, are going to be preferable. And I'm assuming you're not keen on things like fizzy sweet drinks.
Yes, so the hard foods are good for mastication. It keeps your jaws and juices and everything being produced. That's quite important. But generally, you find that softer foods tend to get caught into areas in your mouth which you try to avoid. And usually, softer foods are not that great for cleaning out in between, while harder foods don't tend to get lodged in between the teeth. So that's one thing. But definitely drinking water as opposed to drinking sugar drinks or drinking sugar drinks that have got additives in them is obviously not a great thing, because really water will wash away a lot of the foods and some of the food substances you've got in your mouth. So that's quite important. Having fizzy drinks is slightly going towards the acidic side of creating an acidic environment in your mouth. And actually, it's the acidic environment in the mouth that actually destroys tooth enamel and removes the mineral and therefore leads to tooth decay. So that's definitely not a thing that is recommended. And sweet foods, again, is avoiding that because, again, they lead to the same thing where you increase the sugar, you're more likely to get the acid, which destroys the tooth. So in reality, those kind of foods, sugar foods or rich in sugar, are not a good idea, and neither are fizzy drinks. Water is really ultimately the best.
Okay, that's wonderful advice. Thanks very much. So, I mean, do you have any examples of, within your clinical practice of people who are living with diabetes who have had oral conditions that have been maybe related to a high blood glucose, but treating the glucose levels has resulted in some improvement in their oral health?
So yes, there are a few incidents that I can think of. So I've had clients who've come in and have actually had relatively uncontrolled blood sugar, and it was challenging to actually prevent them from having tooth decay. And every time you restored certain teeth, they'd come back, and those teeth had actually broken down again, and you'd keep restoring them. So you end up getting into this restorative cycle of constantly trying to repair teeth, and eventually, sometimes these teeth become irreparable, and then it means that they're more likely to be lost or they're more likely to have false teeth. So those situations are there, and evidently it happens often enough. But once the diet is controlled, you notice the changes in the tooth decay, and you notice the changes in the oral health generally, so that they're less likely to have restorations done, which can be unpleasant for some, and more likely to have long-lasting restorations as well, because of the fact that there isn't this mineral removal from the tooth enamel, which again can lead to decay or cavities as such. The other area is, I've had clients where I've noticed that the gum disease or the gum inflammation is difficult to treat because it doesn't seem to clear. You give the normal treatment where you do the dental hygiene sessions, and sometimes we go deeper in the tissues. And as soon as it seems to have resolved, it's back again. And it's actually maintaining this to the point where it doesn't progress to the chronic disease and lead to tooth loss. But I've noticed that when they change their diet, it's significantly different in the bleeding gums that they have, the halitosis or the bad breath that they had, that changes dramatically. The gums are actually better attached to the teeth. The bone levels actually change as well, the pocketing around the teeth. So there are many things that you can actually see once the diet changes, and the oral hygiene, of course, improves in reflection to actually improve overall the mouth.
And clients who are sat in your dental chair, are they making that connection between the diabetes, blood glucose levels, and the oral, let's call it ill health, if that's okay?
Most patients actually don't. But most people don't like actually visiting the dentist and having any treatment done. So, it becomes almost a trauma. But because they work with you, the idea is to obviously improve their oral health, and improve the fact that they don't have to have treatment of any sort. They can come in for a regular dental hygiene, they come in for a regular dental checkup. That's preferable to actually coming in and having fillings redone again and again, having to be given an anesthetic for that. But also, if you're having gum issues and you've developed some kind of gum disease, or either the earlier one, which is gingivitis, or the slightly more chronic one, which is in the periodontal disease, it's preferable not to have the discomfort that goes with that, or just the fact that you're having extensive treatment. Not only is it, I wouldn't say unpleasant, because obviously you are given the right anesthetic, but it's the fact it's the long treatments that you have and regular treatments. And in that way, not only the expense of it, it's not necessary if you do the right thing. So they do eventually like the fact that they come in just for the checkup, just for the hygiene, and not have to have any intervention. That's definitely preferred. And so they do eventually realize that, wow, my gums are actually much better now, and I'm not bleeding from my gums. And, it's eventually the kind of penny drops. And they're very keen to actually maintain the oral health once they've realized that it's just educating them around it and improving what they do at home and in the dental surgery.
And you said that that is the case for everyone. And I wanted to ask you, have you noticed any particular aspects that are different in terms of the African Caribbean populations, in terms of oral health and the acceptance of this connection between the diabetes and the oral health?
This has been a really not easy area to actually research, just because the fact that there aren't that many studies on people of Afro-Caribbean origin. So it's very difficult to actually put together a really effective study on looking at the differences, disparities between the different ethnic groups and maybe people who are Caucasian, because of the fact that it depends on one attendance at the dental surgery to actually be able to, review and actually correlate these results. So you find that, generally speaking, and some of the American studies have shown that people who are African American have got a higher incidence of periodontal disease. But again, the studies are a little bit sketchy. And some of those, it's much more to do with education rather than the fact that the ethnicity is something to do with it. And sometimes it's also to do with the social economic standard of where they are, rather than actually saying it's definitely something to do with the ethnicity as such. So some of the studies, though they say it's a higher incidence, there's not enough there to actually put it together. There is definitely one thing, though, that in people who have diabetes, especially in the Afro-Caribbean community, or the African Americans, as they call across the pond, it's really to do with the fact that there's a genetic link to people who have diabetes in that. And also, there's the obesity aspect of it. So people who have there's a certain circumference of waist that they talk about, and it may be more common in people who are of Afro-Caribbean descent in certain areas. And so that would increase the chances of them having the diabetes being uncontrolled and therefore higher disease incidence in the mouth. But again, one has to be really careful to make sure that it is definitely related to the ethnicity rather than just the fact there's other factors that come into play, like, social, economic, or cultural differences in diets and things like that.
I mean, I think this is something that we come across quite often in different aspects of diabetes when we try and look for the evidence. You have to be very careful about what conclusions you can draw from the evidence when there's not a lot of evidence there. Either, as you said, and the evidence there may be more across the pond from the States, and so therefore not always directly applicable to UK, although it may be, we don't know. So it's always hard to sort of draw absolute conclusions. So thanks for giving us that general idea about that from the evidence that is available. And
There've been studies
sorry, go
in
ahead.
the UK. Sorry, there've been studies in the UK, and again, they're again a little bit sketchy because of the fact you couldn't really absolutely say, because the numbers are not enough in the studies to actually say, okay, this is definitely correlates to that. In my own personal clinical practice, I have to say that generally speaking, sometimes we find that the Afro-Caribbean people, because they've got good teeth to begin with, don't feel it's necessary to go and visit the dentist. So sometimes some of these conditions are not picked up until they're quite advanced. And at that point, sometimes things like especially the periodontal disease, which leads to tooth loss, is probably a lot more advanced and by this stage chronic by the time it's picked up because of the thinking that my teeth are good. I don't need to go and see the dentist. So it's really around the education of that and actually attending to a dental clinic and having regular examination and regular routine appointments.
And I wanted to ask you about because you've got such wide experience. Have you ever said to somebody who's presented maybe with oral conditions, I think you need to go and get your blood glucose checked? Somebody who may not realize that they have or are living with diabetes or at risk of developing diabetes. You said it's like a window into the body, the mouth. Have you, in your experience, ever come across someone that you've had to say to them, I think it'd be a good idea if you go and get your blood glucose checked?
I regularly see in the mouth things that indicate that there's something else going on in the system. So by saying that, the blood is the great gate, the mouth is the gateway into the body. Sometimes things present in the mouth and give you an indication that there's something else going on. So, for instance, I've seen it in many times where there've been a generalized fungal infection in the mouth. And like we all know, fungal infections, thrive very well in an area that's got a lot more sugar. So it could be either the diet or it could be something, deeper, like I say, they've got diabetes and they don't actually know. So some of these things I definitely pick up. People who've got dry mouth, who've got ulcerations, for instance. These are things that would indicate that perhaps you should go and actually have a blood test. And have you had a blood test recently to see what your blood sugar is doing once they've actually addressed their diet? Because they might say, no, my diet is pretty good. Then I would actually recommend that they go and have a blood test because there's an indication that there's a slightly higher sugar content in their mouth that's beginning to create these dental conditions that we actually see. So yes, I think definitely in most cases, I do recommend that there's something going on and they need to go back to the GP and actually have a blood test to see if there's something that could actually be shown in those blood tests.
And Sarah, here's $1 million question because, as you've said yourself, most people are not very keen to go to the dentist on a regular basis. So, if you were giving us, let's say, tips as healthcare professionals, first of all, and then as potential people who should be attending the dentist on a regular basis, what tips would you give us? Why would you say it's so important? And how can we encourage people to have those regular checkups?
So, for most people, like I say, the visiting the dentist, as you just said, is not something that is on top of everybody's list. But ultimately, people are affected in everything they do by how they eat, whether they're able to eat, whether they're able to smile. That has a big impact. So tooth loss or having bad breath, these are things that actually impact people greatly, but they also affect their confidence. Going for interviews, for instance, people have greater smiles, tend to do better, perform better in interviews than those who don't smile or don't have good smiles. So there's a lot of things that people consider. But, to smile and to eat well, to eat is a basic function of the body, and something that people should actually want to do. And as soon as somebody gets toothache, the pain that is associated with that, the discomfort that's staying up at night, the holding against this, and not being able to sleep, the development of abscesses and things like this is unpleasant. So it's the message that needs to go across that if you attended regularly, these things are picked up a lot sooner. And actually just maintain your oral health and just going through ways of teaching how to brush your teeth properly and doing the interdental brushing. It's really getting that message across, and the education of that is actually key. And it starts in the young. If you start with young children, you know that you get that adult who's not going to have any dental disease. But again, it's getting that education out to do the simple things will actually give you very good health. And so will lead to better smiles, no tooth loss, and generally more confident, and being able to eat, which should be a basic requirement to just, nourish your body.
And I know that you're very passionate about educating people about good oral health, and particularly for children as well. This is one of your passions. So yeah, thank you very much for that. So was there anything else that you would like to, any tips that you'd like to leave us with? Any words of wisdom or advice with regards to oral health?
Only insofar is wherever you feel. However, you don't like the dentist, they're not on your Christmas card list. Please, please, please just go and see the dentist, because, in actual fact, some of the things that would actually prevent you getting systemic disease is actually can be picked up in the mouth. And sometimes before you actually go to see the doctor or before it presents fully in its worst case scenario in the body, it's worth being picked up. There's many times that I pick up things in the mouth that people don't actually know are actually already beginning to manifest everywhere else in the body. So brushing your teeth twice a day is so simple. Using floss, we always used to say something like floss or die, only because if you left those little bits in between your teeth, they're the ones that transcend down below the gum and actually affect the rest of your body. So to be healthy, you just need to just visit the dentist, brush your teeth twice a day, and use the interdental cleaning and drink more water.
Drink more water and eat hard food.
Eat hard food.
Thank you so much. Thank you so much, Sarah.
Thank you.